Hi, I'm Carol Martin. Welcome to Let's Talk Pain. On this episode, we're going to focus on the communication around pain. We're joined by Terry Altilio, who is a clinical social worker, and by Mickey Brown, a pain management nurse. First, though, a bit about Let's Talk Pain. Let's Talk Pain is not only the name of our program, it's a coalition whose mission is to increase awareness of pain and improve how it's treated. Through Let's Talk Pain, we want to encourage people and their healthcare professionals to talk about pain, to listen actively to one another, and to take action that improves care for those living with pain. Effective communication about pain is really one of the first steps toward positive action. And that communication is exactly what we're going to be talking about in this episode. Often people with pain are unsure when, where, or how to talk about their issues. And so we will start the discussion. First, Mickey Brown. She is currently the communications director for the American Pain Foundation. She's been a registered nurse for over 32 years. 15 of those years as a pain management nurse, coordinator, educator, and advocate. And of course, we're looking forward to your unique perspective from all those years, Mickey.
Thank you, Carol.
Glad you're here today. Also joining us is Terry Altilio. Terry's a social worker and coordinator of social work for the Department of Pain Medicine and Palliative Care at Beth Israel Medical Center in New York City. She's on the advisory council of the Alliance of State Pain Initiatives and has garnered about 25 years of experience in pain and palliative care. Glad to have you with us as well, Terry.
Thank you,
I want to start the communication off with you today about this very sensitive topic. Why is it so difficult to discuss sometimes?
I think one of the unique characteristics and aspects of pain is that it's an experience that we all have in our lives. From the very beginning of our life, we have pain. It's a universal experience, a universal human experience. And oftentimes it's very difficult to understand when that universal experience becomes a big problem in somebody's life and becomes a chronic condition that in fact requires medical care. For many of us, we get pain, we experience it, and it goes away. And we expect it to go away. It's very difficult for us to imagine that somebody else's pain continues and continues, and it doesn't leave them. It's a very difficult experience to identify with. And I think the consequence of that is that we sometimes distance ourselves from people who live with pain on a day-to-day basis, and we minimize their experience, leaving them more isolated, and often they're not even sure when pain has become a problem beyond the norm that they live with.
Interesting. It's seen as a weakness too, oftentimes, yes?
Well, I would say that even within the role of healthcare professionals, there's a misunderstanding or a lack of understanding about the difference of when pain is your natural protector, your biological red flag. Acute pain, sudden pain, tells us when something is going wrong with us or we've had an injury. If we didn't have pain when we were young and we put our hand on a hot fire, we wouldn't know to pull it back. And you could imagine what our bodies would look like as we age if we didn't learn that behavior. But there is a difference between that type of pain that's natural than when pain becomes the disease of chronic pain, when the nervous system goes haywire. And understanding that in a scientific way is complicated and problematic, and many of the healthcare professionals aren't clear on understanding that, and it also reflects then on the people that they care about and the public at large.
Then there's that very murky area of how pain is regarded in our society when it's questionable whether the person who wants relief is a drug seeker or dependent on drugs. Terry, could you speak to that?
Yeah, we live in a very interesting culture, a very interesting socioeconomic environment currently in our country. And people have gotten very confused about the war on drugs and what the disease of addiction looks like versus people who suffer with pain and need opioids and certain classes of medications to manage their pain. It's very complicated, and oftentimes patients and families don't understand it, and a lot of clinicians that are taking care of patients do not understand the difference between relief seeking, which is the seeking of medication for pain relief, versus drug seeking for the purpose of feeding an addiction, which in itself is a medical illness and needs medical intervention. Right. Addiction also is a very stigmatized illness.
Shame,
so to mix up
stigma,
exactly,
the shame, yes.
To mix up pain and addiction, it becomes very, very problematic. And we need, as advocates and as clinicians, to begin to teach and to advocate and to reinforce the difference, not only for doctors and nurses and the medical staff, but for patients and families. They're very, very confused and very worried.
It's a big, big topic. You know, Mickey, you were talking about, too, the medical model. There's a 7-minute something to do with doctors in 7 minutes to take a treatment with a person.
I think it's very challenging in the delivery of our health care now, where physicians and nurse practitioners and physician assistants who are delivering direct care to people that we care about do not have the time that it's required to do the type of evaluation necessary for most chronic illnesses that we have, and particularly with pain, much less if we're going to talk about someone who lives with pain and has a comorbidity like addiction or a mental health disorder. They say that there's an average of 7 minutes that an average physician will have to see that patient to keep the practice moving and forward to care for the amount of people that they have on an average day to seek. And that varies depending on different areas of the country or different practice settings at will. So I
that
think
may be a best case scenario, huh? 7 minutes.
Right. I mean,
wow.
And I think it's particularly challenging for me as a nurse, and I would say pretty fairly for Terry as a social worker, to teach patients how to be very clean and effective in their communication when they have that 7 minutes of sacred time to get their message across, particularly if they're trying to talk about a very difficult topic, which is how they're living with pain or not living well with pain.
I understand. So Terry, what are the points then that one needs to make the most of the situation? Do you come in with your questions? How do you start that communication?
In a number of ways. I think we need to focus on talking in telegrams and not in paragraphs. And you and I know that there are gender issues in how people communicate. And in fact, there are gender issues related to the management of pain. Women get undermanaged, more undermanaged than men do in our country, probably in the world. So we need to think about how to talk concisely, precisely. And somebody once said to me, talk in telegrams, not in paragraphs. So, and for our physicians and clinicians, because nurses also prescribe and have very, very large input into patients' lives who live with pain on a daily basis, they need to understand the level of pain. They need to understand how our treatments are helping them to function, to do what is important in their lives. And you can speak that either in a paragraph or in a telegram. So, and to prepare for the visit, sometimes people keep pain journals. They actually, and this is helpful for some, but not for others. We're all different. We all communicate differently. We're all raised differently in terms of how we speak to each other. So we're all different, and some of these styles are appropriate for some, but not for others. Some people keep pain journals for the very specific purpose of when they go see their physician, they are able to say, this is helping me, this is not, this is the pattern that I've noticed. When I do A, B, and C, I end up spending 2 days in bed because my pain has flared. How can we adjust my medicine? How can we figure out, how can we work together to better manage the pain so that my life is as full as it can be?